sometimes misinformation and disinformation, and especially entities that want to sell miracles they use. So pre-banking is to be alert in general to this exaggerated information and speech. Considering the role of health professionals, Elizabeth, you have a long way working with health professionals. How we can become credible and digital influencers and good influencers, the health professionals, Elizabeth?
Sure. So I'm currently a PhD researcher at the University of West Attica in Greece, and my focus is on midwives, their clients, and the information environment and how it affects midwives and the decisions they make and the care they provide. So I think a lot of the research in the space of misinformation has been primarily on individuals and at the individual level versus understanding how it affects healthcare professionals specifically. I've worked for many years in immunization, particularly global immunization, and the worst possible outcome for misinformation and distrust of health workers is health workers being murdered. This has happened in places like Pakistan when polio vaccination efforts were underway. Harassment and abuse of health workers globally has been a challenge even since the COVID pandemic. And it continues being a stressor in the workplace for many health workers today. It's really clear from the research. We just conducted a global midwives and misinformation survey where we had over 500 midwives from 70 countries talk to us about their experiences with misinformation. And based on that and a lot of the research that exists out there, what's really clear is that the majority of health workers are addressing misinformation, but they are often not trained or equipped or protected. And so often what I like to point out is that asking health workers who are in fact still the most trusted source of health information, and they should be so, if we're asking them to address misinformation, we need to do a better job of protecting and supporting them because it's an occupational hazard, right? If you have health workers, for example, and I have friends who are influencers or colleagues who are influencers online who are pediatricians, who are medical doctors, who are nurses, who are midwives, who do incredible work taking time out of their day. They're not compensated for it to go address misinformation or put correct information out there. They have been harassed, they've been doxxed, and they very often don't get any workplace protection or support for this work. And so I think this is a really crucial component to the larger issue of mis and disinformation, and disinformation specifically if it engenders mistrust or distrust of health workers. I think we need to take this into account and think about how do we better train those who are going through medical school or midwifery school, in this case, who work in public health. That training also includes and incorporates a better understanding of how complex this information environment is and do a better job of not just training and equipping health workers to do a better job of addressing misinformation, but also protecting them and supporting them. Increasingly, patients are expecting that their health workers have all the answers, can address the misinformation, can help evaluate different digital information sources. I think I saw on LinkedIn a few months ago, which I think really stood out to me, was the doctor who was ready to throw up her hands because her patient came into the room and said, well, according to ChatGPT, you should get me this other test. And she's like, no, but I'm telling you that's not the right test for what you need. And it doesn't matter because this person's trust was clearly stronger in what was on her phone screen than in her primary healthcare professional. And so the point here is that doctors and nurses and other health workers of all types, of all stripes, are no longer going to be the sole source of authoritative health information in the eyes of their patients and consumers. People can very quickly get health information from other sources, and I think this is really important to recognize. Increasingly, there's been recent data from the United States, but I also imagine there's similar trends happening across Europe and other parts of the world. People are increasingly going to, ChatGPT or Claude or Perplexity to seek health information. Why? Because they get information instantaneously. It is tailored to them, and they don't have to pay for it, and they don't have to compete for the doctor's time to ask the same questions. If the average medical appointment is 20 minutes and people have a series of questions, it takes time to address misinformation. And that's also something that we heard a lot from the midwives. The biggest challenge they have is that it takes time and effort to address misinformation. And when you only have 20 minutes with that patient, you're not going to be able to offer any of the other care that you're supposed to be offering in that appointment if you're just trying to listen and address that misinformation and educate patients. And so that's why I think that connection to health literacy really comes into play, because often, it's healthcare providers that are in a position of having to teach these basic health literacy skills to their own patients. And so what I'm getting at is, at the end of the day, we need to do a better job of supporting health workers and recognizing this is increasingly as part of their scope of care. It's what their patients expect, and it's also how they see themselves as in their role. And we need to do a better job of equipping them to do so effectively. So the solutions to that, of how we do that, I think there's a lot of questions around task shifting, or how do we increase digital or health literacy among patients? How do we make sure they have access to credible sources of information that maybe your midwife or your doctor would recommend? All those things can help, but it's a